In this video, we'll explore the anatomy and function of the four muscles that make up the abdominal wall: the transversus abdominis, rectus abdominis, external-oblique, and internal-oblique. Let's start with the transversus abdominis, which is the deepest abdominal muscle located beneath the rectus abdominis. This muscle runs horizontally across the abdomen, and its main function is to stabilize the pelvis and lower back. The transversus abdominis helps to maintain proper posture, prevent lower back pain, and supports the internal organs. In addition to stabilizing the spine, the transversus abdominis also supports the internal organs, particularly during movements that involve increased intra-abdominal pressure, such as coughing or lifting. This muscle also contributes to proper posture and breathing by helping to maintain the natural curvature of the spine and reducing pressure on the diaphragm. Moving on to the rectus abdominis, which is the most well-known abdominal muscle. This muscle runs vertically from the pubic bone to the sternum and is responsible for flexing the trunk and creating the six-pack appearance. The rectus abdominis is also involved in breathing, particularly during forced expiration. This muscle contracts to compress the abdomen and push air out of the lungs. While the rectus abdominis may not be as critical for core stability as the transversus abdominis, it is still an important component of the abdominal wall and contributes to overall core strength. Next up is the external oblique, which runs diagonally from the lower ribs to the iliac crest of the pelvis. This muscle is responsible for rotating and side-bending the trunk, as well as compressing the abdomen. The external oblique works together with the opposite side's internal oblique muscle to create rotation and stabilization during twisting movements. When the right external oblique contracts, it rotates the trunk to the left, while the left internal oblique contracts to stabilize the pelvis and lower back. Finally, we have the internal oblique, which runs perpendicular to the external oblique from the iliac crest to the lower ribs. This muscle is responsible for the same movements as the external oblique, but on the opposite side. The internal oblique also helps to stabilize the pelvis and lower back, as well as assisting in forced expiration during breathing. The internal oblique contributes to rotational movements of the trunk and is particularly important during sports or activities that involve twisting. In addition to rotational movements, the internal oblique also plays a role in side bending of the trunk and compressing the abdomen. This muscle, along with the external oblique, contributes to the creation of intra-abdominal pressure, which helps to stabilize the spine and prevent injury. Overall, the four muscles of the abdominal wall work together to provide stability and strength to the core. While each muscle has its own unique functions and movements, they all contribute to the creation of intra-abdominal pressure, which helps to protect the spine and internal organs during movement.